Hi, everyone. Welcome to Arthritis at Home on Wellness Wednesday. My name is Cheryl Cohen, and I'm with Arthritis Consumer Experts, the host of this program. We're so happy, privileged, honored, and many other fabulous descriptors to be here with Alison Hoens. Alison Hoens is a clinical professor and knowledge broker in the Department of Physical Therapy and the Faculty of Medicine at the University of British Columbia. She is the Research, Education, and Practice Coordinator in the Department of Physiotherapy, Providence Healthcare. She is also a knowledge broker, an affiliate knowledge broker with Arthritis Research Canada. We are so happy to have Alison with us today to talk about her experiences as a patient and also as a physiotherapist during the time of a pandemic. Welcome, Alison.
Thank you for inviting me. It's always a pleasure to do anything with our community, so I appreciate the opportunity.
Fantastic. So here's what we're going to talk about. You, as some people might notice, are wearing or sporting a very smart-looking sling, and you've been kind enough to sit down with us today to share with us not just a patient view, but also a professional view, and hopefully at the end we'll be able to touch on that professional view on this period of what it's like to be both a patient and a professional in the middle of a pandemic. Hopefully a spot we'll not find ourselves in again in our lifetime. We're just going to ask you a few questions about those two different experiences that you've been having. So the first one is, I guess you know that our community is made up of thousands of people living with all types of arthritis or musculoskeletal issues in Canada and really around the world. And I think everyone would be really interested, Alison, in hearing from you about what it's like to be a person living with rheumatic disease who just had a shoulder operation, a significant shoulder operation, basically on the eve of a pandemic being declared. What's that like?
Yeah, it's not an experience that I have ever had before. And as you said, I would hope that it's not something that people need to experience again. In terms of the pandemic, that is. For myself, when I had the shoulder surgery, it was February 28th. So that was just about 10 days before all the shutdown of things. So there was, I suppose retrospectively, you could say there was a chance that something like this had happened because we had seen what had happened in Italy, we had seen what had happened in China, etc. But I think there was sort of the perception at the time of, we're not sure if this is going to happen for us, so let's just proceed as much as possible, life as normal. So I didn't know that we were going to be having a shutdown just after the surgery, and nobody knew what that would mean immediately post-surgery. How it was, nobody could say to you as a patient, well, it will mean that you will not have access to your surgeon or not be able to go and see your physiotherapist or things like that. No, you couldn't prepare because there was nobody was aware it was going to happen or what the implications might be. But in short, I can say I feel like one of the most fortunate people on this planet at the moment. Because as many of us do, you wait a long time for an appointment with a surgeon. You wait a long time for the surgery to be canceled. And I actually know people who had their surgery canceled because of the pandemic. So I was fortunate enough to have my surgery and not have to wait an undefined period of time until surgeries occur again. There's obviously some disadvantages with it, but I would have to say the advantages outweigh the disadvantages. And I feel for those who are still waiting.
Yeah, I think I think people who have not undergone a surgery such as you have, I've certainly had a number of them in my life with rheumatoid arthritis, and thousands of people watching have had that same experience. And we'll all say the same thing. It takes a lot to get ready for it. So to rally yourself, to get emotionally and psychologically prepared, to get your home and your support network prepared for, before, during, and after is really an exhaustive sort of process. So for it to be canceled, or such as in your case, to be carried out and then find out, oh yeah, we are in the middle now of a pandemic, is really impactful. And so we're obviously thrilled to hear that you feel fortunate that you had your surgery, you've come through it. I guess the logical next question for you is then, you obviously the rehab process for you has been quite abnormal, I would say.
Yes.
So how you perceive it, you're such a positive person, Alison, which makes you the perfect interviewee for Wellness Wednesday. What do you see as being your biggest challenges so far, but also your biggest wins?
I'd like to start with the wins.
Okay.
Okay. So as far as the wins, so for example, you said the preparation, the rallying for things. Unanticipated then, I had the support network directly in place in my home that I wouldn't have had. So although the first week I was at home primarily alone, a little bit of touch base with family during that time. Since then, my husband has been working from home from his work. My daughter has been working from home and studying from home. And so there has been available assistance when it's your right arm and you're right-handed and you need to open a container, or you need to tie up your shoelaces or do up a zip, something that you need two hands for. There's always somebody here to bug to assist me with it. So that has been my primary win, without a doubt, in having the surgery at this time. The other win was for appointments, for telemedicine. You don't have to commute to get to them, and you don't have to sit in waiting rooms. So those are huge wins. The challenges around it are that in-person contact. So the in-person contact with the surgeon, I did get to see the surgeon to get the stitches out and immediate follow-up, but I need to see the surgeon again to approve my return to work. And being able to access that right now is leaving a lot of phone messages, as I'm sure many in our community are used to doing. The other thing is the in-person access to my rehab. As a physiotherapist myself, I know how much I value being able to use equipment that's specially designed for us to optimize our rehab. Well, I kind of have to, how shall we say, improvise. Necessity is the mother of invention here at home. So I would say that that's the biggest challenge.
Yeah, I'm going to pick up on that thread, the telemedicine thread, which was one of your wins, and seeing some of the silver lining to having access to telemedicine, which I think a lot of patients right across the country currently have. Tell us your experience so far, specifically about that win. What have you found has been positive about having appointments, apart from the I don't have to drive to the doctor's office? What have been some of the things you've liked about your telemedicine visits, and what tips might you give your fellow patients?
Good question. Well, in addition to the commuting, of not having to commute, I think that aspect of in the weight room, especially right now, that you're sitting there and in a time of quarantine, not being exposed to other people. I mean, that's a huge win. This is something that we can all benefit from. But unexpectedly, I think there is more focused attention. Like if you're in an appointment and there's other people around, understandably, your healthcare providers are distracted because they have to be. They're dealing with multiple other people and other demands. When you're in a Zoom call or a GoToMeeting call or whatever, it's focused. So you really, I was surprised by, because I've never had a telemedicine appointment, I didn't know what to expect. I was surprised by the ability to really actually have almost a richer discussion.
I have found the very same thing, Alison. I had a telemedicine appointment with my back specialist. So like you'd been waiting for months and months and months and months for this appointment. And I was so elated when I got this notice that said it's going to be a telemedicine visit. And like you, I found the conversation, I think focused is really the perfect word to describe it. And it gave me, I don't know if it's because I was sitting, in a completely different location, I felt a bit braver to ask or say some of the things I might not say in the actual clinical visit. And I was able to not express frustration, but to say, geez, I have waited a long time for this. So what are we going to do? What can we get out of this now? Given I'm not sitting there being physically examined for my complaint. And I actually loved it, frankly.
Interesting. The social distancing gave you social permission to be a little bit more forthcoming than you otherwise might have been.
Oh, of course, you being the knowledge broking expert would find the perfect way to express that. We want you to switch hats. Put your health professional hat on now and your knowledge broker hat on. And tell us, what are your communities, your health professional communities, thoughts about telemedicine? What pearls can you give them about that encounter with their patients? And also, what can you share with our patient community watching this video? What are the concerns on the minds of health professionals about this whole telemedicine world we're now living in?
I think it's excellent to recognize how it's different for both sides. I think there's a lot of, particularly initially, there was a lot of trepidation. Like healthcare providers, my colleagues in physiotherapy and in occupational therapy and in social work and orthopedics and neurology and cardiology, it didn't matter what area you worked in. You were like, how do we do this? I'm not sure how we do this. So the first thing that I would say to my patient colleagues is recognize that your healthcare providers, this is new for them too. And they're worried about doing it right. They want to do it right. And they don't have a lot of experience in what makes a successful telemedicine visit. What do you need to be able to do? So to patients, don't be concerned. And in fact, it's really beneficial if you could share with your healthcare provider what's working for you in that call. Hey, this is great. This is what I found was really helpful, but also be able to say, hey, maybe this is what I found. Maybe for subsequent calls, you might try asking me this first. Or it would be great to have, I think one thing I learned this morning, it's so funny, the timing. I just got off a call with my physiotherapist. I just did a telemedicine call. And one thing that would have helped me is for her to send me in advance what she would anticipate doing in that call. So saying, I didn't know, if she was going to ask me to move my arm with my other arm, and therefore should I wear a sleeveless top so that she could see my shoulder. Knowing those things in advance, knowing what kinds of questions or movements or whatever would help me to prepare. So I think from a patient point of view, letting them know in a subsequent call that that would help you would be great. For healthcare providers, for people that are, it's, you know, from a patient point of view, I would say, don't be afraid to say, hey, this is new for me. I'm not sure how to make this as good as it can be. Ask me things that can help. So it's really just, it's the same for both sides. Be open and honest with each other that you're not sure what to expect and what could help each of you to do it better.
Those are incredible insights on both sides of the equation, both patient and health professional, Alison. Amazing that you're both willing and able to share them with us today. So terrific that we had this chance to chat with you about your experience. I know that everyone watching has learned a great deal from this conversation, and for you to give of your time and health energy right now when you're going through your own both struggles and wins is really, really gracious, and we can't thank you enough. And we want to wish you a happy birthday too, because we know it's your birthday.
Yeah, tomorrow, but I'm not sharing the age. You can guess.
That's okay. We're not asking you to divulge it, and I'm going to spare you my my singing ability, which is very low. But nevertheless, everyone here at ACE wishes you a very, very happy birthday. And again, thank you so much for spending this time with us today on Wellness Wednesday.
Thank you so much. And I wish everybody in ACE land and all of its wonderful followers also a great Wellness Wednesday.
Thank you, Alison. And thank you, everyone, for tuning in. Please check back to our Facebook page or website for our next episode on Facts Friday. It's been a real pleasure. Please be safe, everyone.
Bye.